is Fox 26 Morning News.
Time now is 8:23. Welcome back, everyone. Heart failure contributes to hundreds of thousands of deaths every year, but there are many ways to treat this serious condition. Dr. Razavi is the Director of Clinical Electrophysiology Research and Innovations at Texas Heart Institute and St. Luke's Episcopal Hospital, and joins us this morning to talk about just how big of a problem heart failure is in the U.S. We're so glad you're joining us this morning. We all hear about heart problems, heart disease, but what about heart failure?
The incidence, good morning first of all, the incidence of heart failure in the United States, there's about 6 million Americans who suffer from congestive heart failure. About half of these individuals require, about 500,000 of them require a cardiac implantable electronic device. And it is the most common cause of death in the United States.
Now that sounds like a really big word, but those are just things like pacemakers.
Exactly.
And we probably know that term a whole lot better.
Absolutely.
But tell me about some other things like that. There are quite a few forms of those?
Yes, there's cardiac defibrillators. These are devices that internally shock the heart when the heart goes out of rhythm. They're so-called cardiac resynchronization therapy devices. These are devices to strengthen the heart muscle actually, and not just to provide it with electronic pacing. So put together, all of these are called the CIEDs, the cardiac implantable electronic devices.
And with a device like that, does that help most people? Are they going to be able to function normally and have a better lifestyle?
It significantly improves quality of life and the strength of the heartbeat, and when placed appropriately. And so these are very important devices, not only for quality of life, but actually for increasing the longevity, because if a patient has cardiac arrest, they will immediately resuscitate the patient.
You brought an example to show us how this works, so if you could explain to everyone, that would be
Sure.
great.
So one of the major complications that we have in the course of implanting these devices is infections, and unfortunately the body is not coping to eliminate the infections. It cannot use antibiotics or things of that nature to eliminate these infections. So what usually happens is you have to remove the device. In this case, however, there's an antibiotic coated seal or envelope, and you place the pacemaker within that envelope. The envelope is then placed under the skin, and then you close the incision. And what this does is it has two forms of antibiotic that are secreted from the mesh itself. And this has been shown to decrease the incidence of infections by about 70%.
That's huge. That makes a big deal.
Absolutely.
I mean, that's a big difference, and has to make people feel more comfortable if they have to undergo this procedure.
Absolutely. Especially since the battery life for most of these devices is only 4 to 7 years, what can happen is as you reimplant the devices, the incidence of infections is even higher.
We're almost out of time, but I just have to ask you how we can prevent heart failure.
Yes. So again, prevention is the and a healthy lifestyle and modifying your risk factors, making sure that your weight is under control, if you're diabetic, that your sugar levels are under control, that you're not smoking. Simple things like that are probably the most effective way of preventing heart failure.
Well, it sounds like important lifestyles that we could all make it just to live a better lifestyle. Thanks for being here today, Dr.
Thank you for having me.
So good to talk to you, and
Thank you.
we appreciate the demonstration as well.
Absolutely.
Great stuff coming out of that medical center, Jose.